Hi there, my name is Sean Leonard and I'm a third year pediatrics resident here at Western. This is my poster entitled HIV Pre-Exposure Prophylaxis, or PrEP. It's time to consider harm reduction care for adolescents. Now in the top left of my poster, I dive into some of the background research about how youth account for nearly a quarter of new cases of HIV in Canada every year, and how the proportion among Indigenous youth is rising. PrEP was actually approved by the FDA in 2018 for youth weighing at least 35 kilos, but in spite of this, its uptake has been rather low. And some of the barriers highlighted in the literature for this include lack of exposure, lack of experience, unfamiliarity with prescribing guidelines and follow-up guidelines. In the bottom left, I'll highlight the current option, tenofovir emtricitabine, and its associated known side effects. But I really want to draw your attention to the flowchart in the middle of the poster. This is a novel tool that I've created that I hope to introduce into the literature that brings together the most up-to-date guidelines from across North America and other countries around the world, as well as expert consensus from leading HIV researchers in Canada. It starts by highlighting the diverse demographics of youth which could benefit from this medication, and following the algorithm downward, it shows providers what kind of investigation and blood work needs to be done before starting the medication, and then what needs to be done at each subsequent visit. I'm hoping that this algorithm and this flowchart make prescribing PrEP a lot easier for family doctors, community pediatricians, and increases their confidence and comfort that this is well within their scope of practice to do so. In the top right corner, I highlight some counseling points which make the prescription of PrEP for youth different than adults, including not needing to disclose this medication to their parents, as well as the importance of very frequent, maybe even monthly follow-up to maximize adherence to this medication. In the bottom right, I highlight some take-home points that summarizes all of the above. But I really hope that this novel flowchart, which brings together some of the cutting-edge research and the most leading guidelines in the literature at this time, can be used by community providers and family doctors across the country to increase access to this valuable medication by youth who need it. Thank you so much.